Well, Nick, welcome to the program. Thanks for joining.
Thanks for having me, Matt. I really appreciate it.
As you know, we're here in the Asian market today, and right post-pandemic, we're curious what LENSAR's plans are for Asia Pacific. Tell us a little bit about that.
So, we are fairly active in Asia now. We're in China, we're in South Korea, we're in Hong Kong and Taiwan, and we have a presence in the Philippines as well. And so we've been pretty active with the folks that know us, and we've got some pretty good distribution there. I think that for me, I'm looking forward to being able to get back to coming out there and visiting and attending conferences as they restart. I think the other thing is that since LENSAR is moving pretty rapidly towards a next generation system with Ally, it's to continue, and it may take us a while to get it into parts of Asia due to some of the regulatory differences there. That I think continued awareness around LENSAR and some of the things that we're doing and bringing to the table from a technology perspective, and a lot of education as it relates to how important managing astigmatism is as routine to cataract surgery. And so we're going to focus really in those areas. LASIK's been pretty successful in Asia, and obviously with LASIK being so successful, people are used to sort of technology driven to get better vision correction and to be able to be less dependent on glasses. And people need to realize that you can do that with cataract surgery as well. And that's what we're looking to really drive.
Well, Nick, Ally is a new acronym as far as I can remember. So tell us a little bit about Ally now.
So interesting from an acronym perspective, Ally really is meant to mean several different things. It's the relationship between the physician and the patient. It's the relationship and really the integral nature of femtosecond laser cataract surgery and phacoemulsification, primary methodology of cataract removal. And it's the relationship between LENSAR and the physician and or the practice. And so that's really, kind of what Ally stands for. But what is Ally? Ally is going to be the first femtosecond laser that will take a next generation laser and is going to combine it with phacoemulsification in a very small, compact device that'll fit into any operating room or surgical suite, whether it's in office or whether it's an ASC or whether it's a hospital, and really is going to be integrating for the first time the functions of the femtosecond laser and phacoemulsification so that we can improve the efficiencies as well as help the surgeons improve the outcomes. We're going to bifurcate the procedure and allow certain aspects of the femtosecond laser to be part of the standard cataract procedure. And then as well as have the IntelliAxis features, the preoperative device communication with the Ally and whatnot, so that we can then treat the premium patients as well. So it's really going to expand the market from not just the premium femtosecond laser or the premium IOL cases that are being done, but really start to push us into more of the broader base of phacoemulsification.
Well, it seems, as you've mentioned, kind of some space, or I should say some space constraints, but maybe in a favorable way. Asia, of course, is often space constrained with some smaller offices and things like that. So Ally fitting into there is going to be an ally, in other words?
Most definitely. The other thing about it that I want to mention is that, today, these are primarily done in two different rooms. And you're moving the patient, you're prepping the patient for the femtosecond laser, then you're moving the patient into the operating room, or you're having to move the patient within the operating room and re-prep and drape the patient. Ally's designed where you're going to prep the patient one time, and you can do both your femtosecond laser and then seamlessly switch to your phacoemulsification device. The other thing it's going to do is that through using some very unique imaging that we have, which we refer to as our augmented reality imaging, where we take these two-dimensional images and we convert them into a three-dimensional model. We do cataract density imaging and grading of the cataract. And so the idea here is that we will be optimizing both the femtosecond laser as it relates to very tissue-specific patient characteristics. And when I say that, we'll grade the cataract. It'll have a custom fragmentation and energy setting pattern that either the doctor can customize based on a certain technique that they're using, or it'll be pre-programmed as far as defaults are concerned into the machine. So the doctor can do either or, choose either or based on that. And at the same time, that data is going to be shared with the phacoemulsification device, because now it's integrated through the same database, integrated through the same graphic user interface. And it'll help the doctor then choose the fragmentation settings as it relates to the phaco: vacuum, flow, tip configuration, phaco power. And so it will improve the efficiencies and the productivity of both of those, so that at the end of the day, they're going to be able to maximize the removal of the cataract in the most efficient way with a minimal amount of energy.
Asia Pacific, depending on where you're looking at, there's always certain price sensitivities that are involved. India is one major market where that's at play. So, with a device that's as complex as the one that you have, how do you account for that in a market like India, where there are certain price sensitivities, but of course you've got this really complex technology? What do you do to make it work?
We haven't found the magic formula yet. There's not a magic formula here. It's really being able to work with each practice and understand that, where we're trying to take it is where we can make the femtosecond laser more mainstream, lower the overall cost of the device to begin with, and by combining it with the phacoemulsification, the overall cost of that device is going to be less than what current femtosecond lasers cost and what current phacoemulsification costs when combined. Right. And when you talk about India, for instance, a lot of the surgeries that are performed there, because they have such a huge volume of cataract surgery, but yet access to care is sometimes more difficult, and it's done on a more more of a widespread basis at much lower cost. So over time, these things will start to merge more together, right? All the governments and with an aging population are faced with the same kinds of challenges, in that how do we get our people access to healthcare and still give them access to good technology in that as well? And I think what people are finding is that after patients have had cataract surgery, if they've had state-of-the-art cataract surgery, they're more productive. They feel better about themselves. Certainly people are living longer these days due to better access to healthcare and whatnot, and we have more active lifestyles. And so these things will start to merge together over time. But our aim here is to bring a higher technology product that's going to be more efficient, that will allow the surgeon to deliver better outcomes, and that will be more cost efficient at the same time.
Well, that sounds like a smart plan. Talking to different manufacturers over the years, it seems like there's been an evolution from, some would say selling boxes to selling solutions. So I suppose if you don't think about, the product in isolation, but as a part of a larger solution, then maybe you can connect the dots and make it make sense to surgeons in the region.
So we look at the cataract procedure as being part of an ecosystem. Yeah. And LENSAR, one of the things that we've done that's been industry leading is that we connect with 5 different preoperative devices, and we connect by being able to import that data via Wi-Fi or thumb drive and put it into the LENSAR, where we can capture a lot of the patient's pre-op data as it relates to their astigmatism measurements and whatnot, and corneal topography. Yeah. And we do the iris registration, and we translate that into precisely placing the incisions, whether they're arcuate incisions for treating small to greater degrees of cylinder, or whether the doctor is going to be using a toric intraocular lens, where we can actually put the two small tabs on the capsulorhexis so they can line up the IOL very precisely. They can also look at that post-operatively and make post-op adjustments if they need to. So the benefit to the doctor is that they're kind of doing surgery one time, lowering the number of retreatments and chair time for the patient. It's great for the patient because it enhances the patient experience, because it allows the doctor, not to have to stage these various procedures, but they can treat the patient at one time during the cataract. During the cataract, they can treat the astigmatism, and whether they're treating the presbyopia, and whether they're treating or just putting in a multifocal lens, they can do all of that, and it eliminates the need to have to mark the eye. It eliminates the need to manually transpose data. I mean, all these things ultimately end up as being, if they're time savers for a physician, they're cost savers for a physician as well. Right. And they improve the productivity. And so like LENSAR, we're really focused as a surgeon-centric company on doing three things. And if we can't answer the question on those three things, then it's a project that we really don't like, we really won't take on the project. It's really improving efficiencies. It's helping the surgeon to improve outcomes, and it's enhancing the patient experience as a result of that. And so for us, everything that we do really gets down to looking as a surgeon-centric company. Does it affect one or all of those three things? And if it does, then we'll take it on, and we'll look at doing that, which is precisely what we're doing when you look at where we are with our current system today, right, and where we're moving with Ally. There's going to be certain core feature technologies that are inherent to LENSAR that will be inherent in our Ally device.
Well, I was just talking to one of the general managers in the region today. We were talking about a few different markets, but that the emergence of chains of hospitals and clinics within Asia Pacific is definitely here to stay. He mentioned Aravind as being one of them in India that's really growing fast. We've also seen Dennis Lam Seamair move from Hong Kong into mainland China, making him a billionaire. So it seems like maybe if there's a way to make a placement within a larger chain system, then perhaps you just need to convince a handful of decision makers, maybe less than a handful, and then you could provide those solutions within chains within Asia Pacific. And these chains are much larger than hospital systems that we would see back in Europe or the United States. So there does seem to be a sort of a bright spot there at the end of the tunnel, so to speak.
Yeah, there is a strategy there, and but that's pretty time consuming as well. I mean, understand that change and what that chain is going to do doesn't happen overnight, because those chains in many cases, they have strata within the chains as well. In other words, they have a wealthy patient base and clientele within the private that gets access to all of these different technologies, and at the same time, they have a very, let's say, a much lower socioeconomic strata where they have to provide care to those groups as well. Right. And so it's not as simple as like the IR group in China making a decision that they're going to do something. And premium cases in many of these markets, putting multifocal and accommodative lenses in and moving to toric lenses, since in some of these markets, phacoemulsification hasn't existed for as long a period of time, and it's a newer technology, and patients, that have been pent up are just starting to be able to get into these systems. There's going to be huge growth on a numbers of patients that are going to be coming into the system. They will be looking at what can we do to be more efficient and more cost effective. But then the other thing is that we have to be able to come together with these large groups and realize that to bring these higher technologies, there are some costs associated with them, and it's sort of changing the healthcare system and the way that they approach the patient to some degree, where it is more personalized and more custom and giving patients better outcome, not just treating the medical condition per se.
It's apparent also the need for solid distributors around Asia Pacific. And, we heard recently this week how, there were some missteps with some of the larger companies, the Alcons of the world, going direct into Southeast Asia and kind of teaching a lot of the SMEs along the way the importance of distributors. I'm familiar with some distributors that have been, I believe, your partner over the year, for example, SwissMed, there in Singapore, where they say that, we bring innovations. So I suppose, strong distributor partnerships and knowing the turf on the ground also would be important for a company like LENSAR.
So very, very important. I mean, so we're direct in the United States, obviously, because that's where we're located. It's a market that we know. But outside the U.S. and particularly in Asia, very important for us to have strong partners. And we have some really good partners, in Taiwan, Hong Kong. We have THI. They've been around for a long time and have a very well-established name in the marketplace. Well, we have Gauch in China, and Gauch has been an awesome partner for us, and we've really been able to collaborate and begin to get some systems into China. We're working on some collaborative. We would have had a really great year last year working together because we had a lot of activities planned where we were going to bring various groups of users together and start a user group meeting and actually bring doctors from other markets that have been doing femtosecond laser for some time into China and interact and meet with the physicians and really start working together much more closely. We also in South Korea, Wari has been a very good distributor for us as well. And so those are really solid, distribution companies in each of those countries that we really enjoy our relationship with.
Now, this isn't such a softball question, but I figure with you playing football before, maybe you're used to a harder ball. So let me ask you anyway.
Ask it.
Well, we've heard a little bit about matrix emulsification over the horizon. That seems like that could be something beyond femtosecond. What do you think is on the horizon in terms of competitors, and are these threats or possible collaborators?
So this is a really good question, Matt, and it's a deep question actually, because first, can I just kind of put it a little bit in historical perspective for you, because then I can frame it a little bit.
Yeah, right on.
So first generation femtosecond lasers, entered the marketplace with like huge fanfare, going back to 2010. So femtosecond lasers for assisted cataract surgery, 2010, great fanfare. The fact of the matter is that most of those systems, and really from the larger companies, that acquired those technologies, most of those systems have not advanced much since their initial indications and initial performance. And so even though you might be able to do an elegant incision with a femtosecond laser, many of the functions were still very manual, relying on sort of the doctor to manually make decisions and how they were going to use the laser to perform. And so LENSAR, we've worked very hard to make relevant type upgrades that are going to, again, get back to efficiencies, outcomes, and patient experience, enhancing all of those things. And so we're moving in that, and very rapidly into that direction, as we've talked about with Ally. So what does the future bring? I don't see, at least right now, from the large company perspective, they have such huge portfolios to manage, and they've acquired a lot of these technologies. And so I see a lot of new intraocular lenses coming into the marketplace. And those new, more complex intraocular lenses will benefit, as the femtosecond laser will benefit from those lenses coming into the marketplace. But from a laser technology perspective with cataracts, there is this sort of matrix laser. I think the challenge there is going to be can that, from an economic perspective, can they make that so that from an economic perspective it works? And the safety profile of that as well, because in order to really do what the laser is sort of talk about doing, you're either going to have to put a lot more energy into the eye in order to be able to do that. And so we're looking very closely at that, and we're doing some work ourselves in these types of things. And LENSAR, we've always had something that's been upgradable. We have a collaboration with Earthly as it relates to the phacoemulsification device that's going to be inherent to Ally. We're not recreating the wheel there. And as a smaller, independent, nimble company, we're always open to the idea that we can collaborate and don't need to create the wheel ourselves necessarily in all instances.
Well, Nick, you answered.
I answered your question.
I was going to say you answered it with a plum rather than a football, so it was perfect. Thank you so much. We really enjoyed having you on the program. You've answered a lot of questions here about Asia Pacific today, things that our readers want to know about. So you're welcome on any time here or anywhere in the world.
Thank you so much, Matt. I look forward to coming back out and seeing everybody and getting into all these different markets.
Great.
Really appreciate the time.
Guys, if you like Cake Talks, you're going to love Cake Magazine, okay? It's real tasty, but seriously, it's all about cataract, anterior segment, kudos, and enlightenment. It's our anterior segment magazine for Asia Pacific and beyond. Have a slice of cake today. Enjoy.